Should you get a Medicare supplement policy or a Medicare Advantage plan? Let's do a comparison of original Medicare with a supplement and Part D plan versus Medicare Advantage. This is going to be a longer video, so if you don't have time to watch it now, make sure you save it and you can click here to reach me if you're looking for any sort of help. So once you've decided you're signing up for Medicare, what you do is you start through the Social Security Administration. Whether you're going original Medicare or Medicare Advantage, you're going to sign up for Medicare Part A, your hospital coverage, which is a $0 premium. Typically, if you've earned it through your work history, you need the 40 credits. And then for Medicare Part B, and that's your doctors and medical coverage. The standard premium in 2023 is $164.90. Some people have an IRMA, which is an adjustment. They pay higher if they're higher income earners. Whole nother discussion with charts that you can look at to see what that premium would be. But the point being is whether you go original Medicare or you go Medicare Advantage, you will continue to pay that Part B premium. But now, once you have signed up, your work is not done. You're deciding which path you're going to go. And here's where we're going to break down the similarities, the differences, etc. So first of all, when you think about original Medicare, think about paying up front. You're paying these premiums whether you go to the doctor or not, but you know exactly what you're spending. When you think about Medicare Advantage, you think about paying as you go, because you may have a $0 monthly premium, but you're going to contribute with copays and coinsurance. So I am going to start with this side of the chart. And if you look at it, Medicare, original Medicare, is not designed to cover every dollar. So what happens is once there's a Medicare approved claim, there are dollar gaps. If you have a $1,000 bill, maybe Medicare's paying $800 of it and there's $200 remaining. That is why people get Medicare supplement policies. Most of my clients tend to choose plan G or N. Depending on which plan you're in, that's going to determine how many of the gaps are covered. By the time a claim gets to a Medicare supplement company, it's already approved. It's an approved claim by Medicare. And the question is, based on your supplement, how much of the claim are they covering? Your premium is going to be determined by your age, your sex, your zip code, all sorts of factors. So if you're looking for that, we have to know a little bit more about you to help you figure out the cost. Now, if you notice in this column, I have an X, because if you take Medicare Advantage, you're not getting a Medicare supplement policy. The next thing is that once you choose your supplement, you're also going to think about a Medicare Part D plan. That's prescription drug coverage. Now, there are some medications covered under Part B, but that's more injectables, IVs, chemotherapy, different drugs in a medical setting. So this is the drugs you think about when you pick them up at the pharmacy. And you are going to have a monthly premium. You also may pay a higher premium if you are a higher income earner, that same IRMA adjustment. And then once you're in a plan, you're going to possibly have deductibles, copays, and coinsurance. We take your drug list to help you figure out which is going to be your most cost-effective plan. If you notice over here, there is an X, because if you went Medicare Advantage, you don't get an independent Medicare Part D plan. So now we're going to take a second. We're going to switch to Medicare Advantage, and we'll go back. Now, what happens is that if you're not going with original Medicare, where the Centers for Medicare and Medicaid Services handles your claim, then you are going into managed care, typically an HMO or a PPO. You still have to pay for your Part B, as I mentioned. You sign up for A and B, but now the care is going to be managed by this company. Now, when you look at the plans, there's going to be multiple plans offered based on your zip code. Most of them have a $0 monthly premium. There could be some where there is a monthly premium, and you decide based on the way they present their plan if that's a good option for you. While you may have a $0 monthly premium, it's not free, because you have what's called a MOOP, a max out of pocket, that you can spend under that plan. And each plan defines it differently. And what happens is that the way that you pay towards that is when you have different services, you could have copays, coinsurance. And so, for example, if you had a hospital stay, maybe you'd have 3-night stay, and each night you had to pay $250. That would go towards the max out of pocket you could spend. Now, typically with these Medicare Advantage plans, you're going to have prescriptions built in. So under that scenario, if you have a Medicare Advantage plan with the prescriptions built in, you also could pay that IRMA for Part D even though you don't have an independent Part D plan. And then once you're in the plan, just like the standalone Part D plan, you're going to have possibly deductibles, copays, and coinsurance. And those costs that you spend do not count towards your max out of pocket. So now I'm going to talk about the rest of the categories. But you can see, pay up front, pay those premiums, whether you go to the doctor or not, but you manage your costs and you have the supplement cover most of the dollar gaps, or you go over here, you eliminate these premiums, but you do pay copays as you go. So that was an overview of the costs. Now from a very broad standpoint, because obviously we have to get very specific to you. We need to know your zip code, your medications, your doctors, etc., to figure out like which way you're going and which is your better path. But let's talk about the other ways that we would compare Original Medicare and a Medicare Advantage plan. So first of all, when you're in Original Medicare, you don't have doctor networks. You can go to any doctor that accepts Medicare, and they're also then going to accept your supplement, because the so-called network is the same for your supplement as it is with Original Medicare. If you're a Medicare Advantage, you are going to have networks. If it's a PPO, it's going to be broader. If it's an HMO, as you already probably understand, that's a closed, smaller network typically. Now, under Original Medicare, you do not need referrals. In Medicare Advantage, if you are in an HMO, you're going to need referrals to see specialists. Under Original Medicare, when you get some of the, your services, you don't need prior authorization from the Centers for Medicare and Medicaid Services typically. You may need it for durable medical equipment, but when you're in Medicare Advantage for some of the bigger services, you're typically going to need prior authorization. Now, one other thing to know, you see all these commercials in the past or current, and they're talking about dental, vision, and hearing, or gym, or meals, or flex cards, etc. Under Original Medicare, you do not have those kind of perks. You can purchase a private dental, vision, hearing plan, but that is not built into your coverage. Under Medicare Advantage, you're going to have a lot of different perks: dental, vision, hearing, the gym, etc. So when you're looking at this is kind of a broad overview of a comparison of the two different systems. Which is going to be better for you? That's to be determined based on a lot of different factors. So you're going to want to start here learning the big picture, and then, like I said, you get down to the specifics with you to figure out which way you're going to go, what's going to be the best path for you.